Hi, everyone. My name is Dorian. I'm hosting MedTech Trends. Today, we have with us Dr. Taylor Bean. Now, Dr. Bean is a mother of 2 toddlers and a board-certified naturopathic doctor. She's graduated from the Boucher Institute of Naturopathic Medicine in 2012 and has experience working largely with families, young children, and moms-to-be. She brings her wisdom as a mother of 2 to help women achieve a healthy pregnancy and smooth labor. Now, she's also worked overseas for 2 years, which improved her skills in chronic illnesses as she saw various patients in Southeast Asia, India, Australia, who were unable to find the care that they needed. She returns to Singapore annually and works in Maple Ridge in British Columbia for the rest of the year. So welcome, Taylor.
Thank you for having me.
Now, today I wanted to talk about naturopathic medicine and some of the types of patients that you're able to help, and also what effects the natural and holistic treatments have on those patients. But first, I wanted to ask you about your experiences working in Asia, actually. So how did that start?
Well, when I graduated from naturopathic medicine in 2012, my husband and I moved to Dubai, and shortly thereafter, I got pregnant, and we were already slotted to move to Singapore together. So we moved to Singapore, and my son was born in Singapore and started seeing patients about 6 months after he was born. And that's where it all started. And there was at that time only 2 NDs. Currently, there are, I think, 4 NDs in all of Singapore. There are many naturopaths, people that do board certified NDs that are in Singapore. And of a country of almost 6 million people, you can imagine that you could be quite busy, bringing forth that kind of functional integrative medicine that I think a lot of Asia is missing. And I still want to go back because the things that I learn here, I bring there and are still very applicable. So it was different. I saw different things there, which I do not see in Canada. When I do see them in Canada, I know what to do. So it really broadened. I saw a lot of people that had seen specialists within Singapore, which is an excellent place to live for medical care. You can get MRIs within 2 or 3 days. So that healthcare is very top notch. And so, but the other side of more functional side, integrative, even within Southeast Asia, because it's a more of a different training that you have to do in order to know how to do things from a functional approach. So there is still a great need, I think, for that side of medicine within Southeast Asia and Asia for certain things that, I saw patients that had seen everyone within Singapore and no one was able to help them, and I was their last resort. So, and I saw great gains. They saw great gains.
You mentioned a lot of really surprising things, actually. I didn't realize that, because usually when I think naturopathic medicine, I think kind of like an East meets West type of thing, but the Eastern traditional type of medicine is something that we borrowed from that part of the world. But you're saying it's actually like the reverse, like our practices and teachings need to be brought over there?
So it's still a blend. It's still going to be a blend. So in the East, of course, traditional Chinese medicine, TCM doctors will work in hospitals. They can, do that piece, that acupuncture piece, and a little bit of herbal medicine. But that's one arm to medicine. And then, of course, there's the biochemistry, looking at the function of the body and looking at the body as a whole from other aspects. And as a naturopathic doctor, you bring it all together. So you wear many different hats, looking through many different lenses. So you have training in traditional Chinese medicine, you have training in conventional medicine. So, if I think a drug is worthy, if I think doing a lab test is worthy, I will use that. But then, of course, botanical medicine piece, from spinal manipulation piece to nutrition piece, nutraceutical piece, homeopathy piece. So there's many different angles that which a naturopathic doctor can approach the situation. And of course, it's that clinical experience, how long, what potency, and so forth. And so we use a blend of it all. I mean, I, in Singapore, could not prescribe anything pharmaceutical. In British Columbia, we can. So if I need to do antibiotics, I can prescribe those. If I want to send for labs, I can do that. So in Singapore, there was a conventional side that was lacking, which was fine for me because I had great medical doctors around me I could refer to, and then they could be that piece within the puzzle of achieving wellness in someone. And I needed to rule certain things out, rule in certain things, and then we're like, okay, we know exactly what's going on here, and now we can move forward from different angles. And of course, people will be more comfortable, or they've had a bad experience with something, they don't want to do that, so they want to do something different. So of course, as a naturopathic doctor, you have many tools in your toolbox to go to, which is what's so fascinating about it. But yes, there is the East as well, but it is still, it's an East West. But what's interesting about Singapore is that medical doctors in Singapore cannot leave the lane that which they're in, so they need to stay within that conventional model, and they cannot come out of that. And so that's what they're doing, so they can't go more functional. They have to be very careful or very strategic if they start doing nutrition, supplements. Singapore, it's very heavily regulated that way, where other countries in Southeast Asia may be a bit different. But that's the experience in Singapore. So then as myself coming over, it's like, well, I understand what you do, and let's add on these other layers to the health. And then we don't need that anymore. Let's add in this now. So, that's the beauty of naturopathic medicine. It can be the difficulty of naturopathic medicine is to know what specific things should I start with first.
That's good to know. Okay. Wow. Yeah. You touched on a lot of things that I actually wanted to ask you questions about. But okay, maybe we can kind of tackle these one at a time, because I'm trying to maybe demystify some of these things. Usually when people get sick, the first thing that they think about is, okay, I have to go see my family doctor. And I didn't realize this until probably only a few years ago, but your family doctor can actually be a naturopathic doctor. But it's just, for some reason, it's not as mainstream. And I think that sort of, there's not as much information out there. So it's hard to really evaluate the full, really the value of going to a naturopathic doctor, which sounds like the approach is a lot more holistic and there's a lot more to offer if you do go to a naturopathic doctor. So one of the things I wanted to ask you about is, since you mentioned it's difficult or it's a more comprehensive approach that you would have to take to decide what is the first thing that you would need to use to address a person's ailment. So what approach do you take? Let's say somebody walks in and as an example, they have a fever. How would you go about looking at that versus an allopathic physician?
Well, so yes. So naturopathic doctors typically are going to be about vitality, the vitalism of the body. And each person that comes in with a fever, if I see they're weak, fragile, they've had a fever for a long time, they're not doing well, and how hot they are, and if they're an infant versus an adult, then obviously strategies will be different. And so there'll be a cutoff point when it even comes to a fever that, okay, we need to use an intervention at this point. And the age, if it's an infant, we use interventions right away. If it's a 5-year-old, and they're running at 38 degrees, okay, how are they behaving? Are they lethargic on the floor? This isn't good. Okay, we need intervention, antipyretic. So we'll go to something like Advil or potentially Tylenol, and do that intervention that way to bring it down. Of course, as a naturopathic doctor with a fever is a good thing. And I know that might scare people, like, well, a fever, this is scary. I don't know what to do. We need to do something. We need to do something now. So I think people have to understand, we all need to understand that the human body is incredibly intelligent, and a fever is going to mean something, and a fever is useful. You heat the body up, what does that do? That kills. So if you have an infection, that is your body's way of killing it, is through that heat system. If we suppress that heat system, yes, you've gotten rid of the fever, but no, you haven't gotten rid of the problem. And so we know the cause, then we know how to treat it, and then it's over. It's gone forever. Rather than, well, we don't really know the cause, so we're going to continue abating these symptoms with something. Either it's a supplement, because supplements can do that too, or it's a pharmaceutical drug. Like, well, we'll just get rid of the symptom. We're still not getting rid of the cause. So with the fever, it is, each individual is going to be, a fever is either we suppress it or we support the body, is the two ways you're going to deal with it. And so those are the two decisions that will be made: suppress it or support the body. And depending on the height of the fever, well, either and the age, then we do something more aggressive or not. That's the same from migraines. We have pain. Why do you have pain? Where do you have pain? How often do you have pain? What could be a trigger for your pain? So there's all these other questions. And the light bulb will go on sometimes for people like, oh, every single time I do this, I have a migraine. Okay, well, let's just stop doing that. Because obviously that's a trigger for you. Okay, every time I get a massage, I feel better. Well, maybe your muscles are really tight, so you need to work on that. Someone has digestive problems are a big one. A lot of people suffer from digestive problems, be it bloating, reflux, constipation, diarrhea. Obviously something's going on in the gut, and, we can take things that can suppress those symptoms, or we can get to the root cause of that so that you never have to take something that suppresses it ever again. And essentially for me, when I see people in my office, I want to put myself out of business, shall we say, resolve the issue and you never have to come back. That is the point. That is the point of medicine. You come see me, we figure out what's wrong with you, we fix it, and see you later. And then the next person comes with their problem. So that's sort of the function part of it, is looking at what's the functionality of the body. Let's look at all these aspects from physiology, biochemistry, mental emotional piece, and then apply what we know we have to that. And this is when you see a naturopathic doctor. Yes, you may have a different experience with each doctor, because they've tried different things, see what works, but the end point, the goal is exactly the same, because there's different things you can use to achieve the same goal. There is. You might think, well, this doctor, why is this doctor doing this, and that doctor doing that? Well, we're still getting to the same goal. It just happened to like one product over another. And then being very integrative with it. So it's very important to have a medical doctor on your team if you're going to have also a naturopathic doctor is your primary care doc. But if you need to see a specialist, I have a lot of people like, you need to get a referral for XYZ, and I can't offer that for you. I'm over here, going to help you with more of the functional end. But if it's an immediate acute problem, you may have to, go to the ER, or you need a specialist to help you with this. You need to have more than one person on your healthcare team. And I think people are starting to realize that, because each of us can only offer, a subsection of healthcare. I can't do it all. I don't want to do it all. There's only certain things that I can do, and I want to get good at what I actually can do, and then leave things like physio, chiropractic, cranial sacral, all these other modalities to other people that are very proficient and very good at what they do. And that's okay. So go see them and come back here for something different. So, yeah.
So one of the things that you mentioned that really kind of paints a certain perspective on the approach here. So if I'm understanding this right, the idea would be that if you go see a naturopathic doctor as a patient, what you might expect is that they'll bring in a different perspective on the way that the illness is affecting you. So they're looking at the root cause of it, and so the approach to actually treat the patient, to heal the patient, is just fundamentally different than it would be if you were to walk into an allopathic doctor or like a family doctor's office. So it's not necessarily that the two disciplines have, one medication or one treatment that'll treat the exact same thing, but in two different ways. In other words, you're not going to find, let's say, like a supplement that'll do the same thing as a drug without the side effects or something like that. So they're not equivalent from that perspective. In fact, they're actually quite different. So it's a different approach and a different tool set that you're using when you're treating your patients.
Exactly. So my toolbox is full of different tools. And one of those tools may be, an antibiotic. It might be Advil. It might be an antidepressant. It's something, that for you, let's do this for you now, but know that this isn't going to be long term. There's be a financial decision as well, because of course, if I write a prescription, it'll be covered versus a supplement is not. So the decision can also be a financial decision as well, but then understanding the decision that you're making. So when someone comes to see me, or any other naturopathic doctor, typically the first visit is 1 hour. So
Wow.
you're going to be going through a lot. And a 1 hour sometimes is just not enough, because you can be going down certain rabbit holes you didn't realize that you were going down. And people are just like, I didn't even know this about me, or, oh my goodness, I wanted to talk to someone about this, because it's a lot of talk and a lot of me listening to, those ailments, those frustrations, those, adverse events to certain pharmaceuticals. And people are just like, I don't want to do this anymore. It's not working. I feel numb. I don't feel, I can't think. There's got to be a different way to do this. And so then we look at a different way to do this. And a lot of times, like, well, you have digestive issues. In your digestive tract, 80% or more of your serotonin is made. Serotonin is needed for mood, happiness. So we have to go back to addressing your gut function, which will address your mood. And so a lot of people, there is, a domino effect with a lot of different parts of the body if they're not operating well. One thing leads to another. So we have to go backwards and backwards and backwards to fix it. And it's like, wow, my energy is better. My skin is better. My hair isn't falling out anymore. I'm like, well, because they're all connected. And that connection of your body of different integrative and functional aspect is all about. Because, for example, if you paint a picture of we walk into a dark room and we're touching something, but a different part of it. And let's say it's an elephant. I'm touching the leg, you're touching the husk, someone else is touching the ear, and they're like, oh, this is a leg and this is an ear. It's like, it's an elephant. That's what it is. But you didn't realize that was the whole picture. So treat it as it's an elephant, not as a leg or an ear or an eye. It's like, well, it's all connected. And I think that that's a really important aspect of naturopathic medicine. And this is where, in the States anyways, a lot of medical doctors are now doing training at the Functional Medicine Institute and becoming functional medical practitioners. Nutritionists are doing this, nurse practitioners are doing that, medical doctors. And so to further their understanding of that function, that integrative approach to medicine, because they don't want to work on one system anymore. If things aren't working for them, they want to see progress. I'm going to be working on your arm. I can't work on the rest of your body, but I got to learn how to do it. And so a lot of those fundamental aspects of learning functional medicine is derived from naturopathic medicine. That's where those theories come from, in terms of that functional part, that integrative part. Healing the body as a whole, doctor's teacher, obviously, to do no harm. So all these principles that we go by really is what we're all about, and how we achieve that ultimate goal is simply just wellness in a person. And each person that may have similar symptoms or ailments is going to have to be approached in a different way, because why you got there can be due to different things. No.
Is there a convergence of the two disciplines, do you think? For example, you mentioned that part of the role of a naturopathic doctor is to embody evidence-based medicine. I think that concept came out of the allopathic side, I believe, or I could be wrong. But evidence-based medicine is like the cornerstone of modern medicine. Everything has to be a decision-based approach. And
Right.
so, as a naturopathic physician, you're also getting trained using that same philosophy.
Yes. So, within the training, yes, it's going to be an evidence-based approach. But there is room for movement within that as well. So there might be something that I've done for someone, and the medical system does it as well. Off-labeled use of drugs. It's not evidence-based, it's off-label. And that will exist in naturopathic medicine as well. Like, anecdotally, we see that this is happening, and therefore, we're going to use this agent. There can be at times is a large random, controlled trial, double-blind placebo trial, because the money isn't there to do it, although it's coming. There's more money that's coming into the alternative world to sort of, okay, let's put our feet down and now we have the money to do it. Let's do the research of something that, isn't there yet. But the tendency absolutely is going to be towards evidence-based, and, looking at, okay, well, why would I use melatonin for someone with migraines? Okay, look, there's evidence that's showing that, using either IV or oral of melatonin has reduced frequency and severity of migraines. Okay, great. Going that way, or L-carnitine has been shown to help with constipation in children. Okay, so now we can do that because we have more and more evidence coming out. And I would say the alternative world produces a lot of evidence on a monthly basis. The microbiome has just exploded in terms of addressing and looking at, the evidence based around, the microbiome and what that means and what that entails for our mood and skin and energy and so forth. So, yes, so that is a big piece when it comes to a naturopathic doctor is coming from the mind frame of evidence-based.
Mm-hmm. We'll come back to the evidence-based piece a little bit later, because I wanted to ask you how that sort of integrates with technology and how people can make use of it, how the general patient, how the average person can make use of it, because there's so much information out there. Now we're in the age of sort of sifting through all this information so that it's actually usable and digestible for the average person, so that they can make some informed decisions on their own before they have to get professional advice. But it's definitely a huge topic. So we'll come back to that.
Yeah.
And I wanted to also ask you, so some of the patients that you treat in your practice, you mentioned patients with conditions like autism, ADHD, Lyme disease. Can you tell me a little bit about some of those patients?
Right. So children on the spectrum, a large area that I support, and it's more around optimizing their health, right? So a lot of people, I'm going to say this, a lot of people think that supporting children with autism somehow means I'm here to change them. And I really need to make sure that people understand that is not the point. The point is to optimize. So a child with autism, just like another child that will be neurotypical, has constipation, has eczema, clearly is experiencing pain, isn't sleeping well, so ADHD, we're hyperactive, a difficulty paying attention. So how do we optimize from supporting brain function to neurotransmitters, to gut function, reduce this inflammation, because inflammation can stimulate things like mast cells, and then we have histamine release, and that is excitatory. So it's about optimizing the health of these children. And I have seen great gains. The parents have seen great gains. So it's not about changing the child. It is about optimizing their health. And I'm really being really want to say this, because it's sort of this misnomer that, well, just because I'm supporting a child with autism somehow means I'm trying to change them. Autistic children are on the spectrum. So yes, you can have Asperger's, so to the other end of the spectrum, where children, they have no speech, a lot of stimming, even walking, there's, ataxic, they're apraxic, to maybe there's all these different aspects that I see. The SPD is the same, so sensory processing disorder. I see children with pandas, so will be infectious origin typically, and then Lyme, people who have been diagnosed with Lyme disease or co-infections. So in terms of Lyme, the CDC has changed their rates from, I think it was like 3,000 a year to now 300,000 diagnosed with Lyme per year within the United States. We have certainly pockets of people with Lyme within Canada, but I think we're missing out on a lot of people that actually that do have Lyme but have no idea what is going on with them. The unfortunate part of testing in Canada for Lyme needs to be improved. So the doctors, medical doctors, there's very few, to naturopathic doctors that work with people with Lyme, do not use Canadian testing. We use Germany, or some will in the United States. I use Armin Labs in Germany. It's a different way of looking at the immune system. And so we use that more so for testing for Lyme. Although, yes, testing is not 100%. But certainly it can give us perhaps an idea if this is what we're dealing with, because people want to know, why do I feel this way? And then, okay, well, how are we going to make you feel better? Not really caring maybe what the what is anymore. It's almost why, and then let's go forward. So these are, I've chosen, shall I say, areas in my office of ailments that would be more of the challenging ones.
I was just going to say, you did not go the easy route.
I don't know why. It was just, I didn't, a lot of my colleagues do women's health, and I don't do a lot of women's health. And so I just, a lot of my colleagues do, aesthetics. They do Botox. I don't do Botox, to inject these, but I think I have a brain that gets bored easily, and I don't want to do the same thing every day. I want to see challenging different things. That's, it's not exciting. It's just more of, okay, I got to put my mind to paper, and I need to attend every single conference that I can to learn more about how I'm going to deal with this. And so it has separated me a bit from my colleagues, simply because I'm doing things that this just takes years to understand how to help someone. But hey, I'm going to be here for a few decades, so let's just learn as we go. And a lot of stuff that, what I learned is not taught in school. I mean, you're taught, about the body and the function of the body, and from pathology and physiology, and you have, you name it. And then it's when you get into practice, now you're practicing. You're actually, well, let's see if this helps you. There is evidence around this, or perhaps there isn't strong evidence around this. All that informed consent happens beforehand. And so people can make that educated decision. And there is lots of information online. So, from an herbal concoction to maybe an antibiotic, and people can still learn. And the beauty of Facebook forums is, it can bring people together and share their experience, and, say, hey, I used XYZ and I have been diagnosed with Lyme, Babesia, maybe Bartonella. I think maybe I have mycoplasma. And so I've been using these things and I feel better. Someone else might try the exact same thing and not feel better, because obviously they have something lingering in the background that hasn't been, treated yet. And so this is where the Facebook forums come to a limitation, because although you're trying to either diagnose or self-treat, sometimes you can do more harm than good, because you didn't realize strategy of things. You don't just start one thing and go really hard. It's like, no, you might not be able to deal with this, and we could be causing more problems, and we need to do a little more testing. And yeah, this is something you should never start with. But how would you know that? You're just trying to treat yourself. So yeah, which is great. There's lots of Facebook forums that people can navigate and help. But yeah.
Yeah, I'm sure a lot of people would benefit from knowing about that. That was one of the things that I was interested in as well, is that there are a lot of different communities out there. Some where you can get a subscription, and then you can connect with people that have had similar experiences, and you can talk to them about what therapies they got. Because it seems to me that, so we're in an age where, yes, there's a lot of information. There's also a lot of variability in the approaches that people take, and you definitely mentioned this when we started. There's this idea of personalized medicine nowadays, right? Every patient is different, and that is because of the life experiences that they have, and all the different things that kind of add up to their condition and where they are right now. But so there are a lot of different resources that people can use to actually get information about their diseases, but at the same time, and how to treat themselves. But at the same time, everybody's so complex, right? These are all very complex conditions. Can you think of an example of a patient that actually, say, greatly benefited from the therapy and the work that you were doing with them? Someone that really stands out and how you helped them?
I'll use a more recent case. I think the boy, I think he's around 8 or 9, and was urinating frequently throughout the day. 20 to 30 times he had to urinate. He was becoming more isolated, didn't want to go outside, want to stay in his room. And the mother simply said, this isn't my son. I don't know what's going on, where, now there's anxiety around having to pee all the time and urinate, so now it's affecting school. He doesn't want to go to the park. He doesn't want to play. What is going on with him? And so she'd seen specialists, neurologist to a nephrologist and pediatrician, and they didn't have any answers. They just essentially just diagnosed it as what was happening, but not knowing why it was happening. So from the behavior aspect of a slight OCD side, I was thinking about potentially pandas with this child, although I didn't really think it was yet. So I prescribed a really broad spectrum antimicrobial herbal concoction. I like using biocidin. It's a product that people can get online. And there's a lot of evidence around biocidin to even Lyme, to yeast. Exactly what was causing this, but I knew there was probably lingering in the background some sort of lingering low-grade infection. So instead of doing a bunch of tests, the biocidin, which were used for a short period of time, we did that, and I saw the child about a month later, and the urination had decreased by 80 to 90%. He wanted to go outside. He wasn't, isolating himself, retracting himself from his family and friends. And she's just like, these are the moments when parents come in tears, because it's like, I don't know what you did, but I have my boy back. He's my son again, and he wants to go to the park, and the anxiety has lessened because he's not urinating as much. And these moments are beautiful, because even though I didn't know exact cause, I didn't know the exact infection that which he had, I addressed it with something with a broad spectrum. And this is where you, through advanced training and learning, then you have all these sort of back up and look and like, okay, well, they've gone through the correct routes. They definitely, ruled out, certain things that were pressing and maybe were problematic. And that wasn't the case. And then, okay, well, the next layer needs to be added on. But they didn't know where to go from there, because nothing on paper is saying that anything is wrong with this child. And I hear that so much in my office, where people will come in and say, well, all my blood work, my urine, everything that I've done says I'm normal, but I am not normal. And what typically happens is the next stage is the GP will say, maybe we should put you on an antidepressant. Maybe that's what you need. I think it's just in your head. And I've heard that too much, that it just slices my heart each time I hear that. And, when you're in this business, you need to have some compassion for these people, because I know that is what's happening for them. I know that. I don't have hundreds of people that come in to tell me something that's not actually true. No one's going to pay to tell me something, not at the frequency that which it happens. And then when I start supporting them, and when they say to me, I am feeling better, and they come off of those things and they still feel better, great. So whenever it was, and if we did, it's more functional testing and we found stuff and we treat that and retest and it's gone, great. We found the cause, treated it appropriately, and that was great. So that, just hearing that from people, that people don't, my doctor thinks there's nothing wrong with me because on my test, it says that I'm totally fine, but internally I'm not fine. But that one story I think really shines to me, because it was so simple, shall we say, that using basically one or two components, and the child got a lot better. And it wasn't a miracle. It's not what it was. It was the fact that I used something that was appropriate and necessary. And, they were touching the leg of the elephant, and I just knew it was an elephant. And so we went there, and I haven't seen her since. I mean, there's more of those. I nailed it. There's moments I don't nail it. But there are definitely these moments, and that's just what obviously keeps you going, because you're like, these inspiring moments as a practitioner, like, well, I just love hearing these stories, and so I've got to keep doing this. And they will tell someone who maybe is experiencing the same. And I don't know if she was in a Facebook group with children with similar, symptoms, and then, she tells them, and so it just keeps going in her that, okay, there's another way of doing this. Yeah.
I think that point really hits home, that that there is more of an art, or maybe not more, but there is a big art component to this, in that you can rule out a certain number of things, but you can't always get inside a patient's mind to know exactly what it is that's bothering them, or in exactly what way. And so no matter how many tests you run, sometimes those tests don't really reveal what the real problem is. And so to have more tools in your toolkit to approach that problem, or a different, if you can kind of turn on a switch and change your mindset to, rather than treating symptoms, you go into the root cause, and maybe there's other things. But those are the kind of things also that only come out through an in-depth conversation, right? You can't do that in like 15 minutes or 10 minutes or even 5 minutes. I've heard some physicians spend as little as 5 minutes. So it's a very interesting approach, for sure. It really, that message definitely hits home.
Well, and that, when you hit it too. I mean, for me to see someone for an hour, and my follow-ups can be 45 minutes to 30 minutes, you get a lot done in that time. And no, a medical doctor cannot get that much done in that time. And that must be really frustrating. I would be frustrated that I can only talk about one ailment with you, and that's it. I can't talk about anything else. Although other ailments might tell me something I needed to know on how more appropriately to have treated you. And so that's a broken medical system. I mean, that's going to be hard for some people to hear, but it is. And I mean, if you really want to achieve, substantial, optimal well-being, you got to understand the entirety of the person, and hear them as well. Because even though I don't feel their pain, doesn't mean it's not happening. You look fine and your tests look fine. I guess it's just more in your head, and that is just beyond disrespectful. I don't even know how to describe that. I just, the just being so let down. But then I am on the side of the GP of like, well, there is only so much you can do. You are there for those acute trauma type situations, but these sort of, unknown etiologies, they're not life threatening. You look like you're fine. So I guess you are fine. I don't know what else to do for you. So I think we have to understand that there's a limit to what each of us as health practitioners can offer and do, and be okay to say, I don't know. I really respect GPs that say that. I really do. It takes a lot, I think, sometimes to say, I am so sorry, I do not know what to do. You're going to have to seek out another person to help you, because I don't have those tools. And that's okay. I don't know how to address that, the mental emotional aspect. You have to see someone else that can do more in-depth, emotional support for you, because I don't know how. And that's okay. So we have to kind of let the pride down sometimes, and the ego, and be okay with not knowing everything.
I completely agree. And it's difficult for people to do that sometimes, especially after you go through, 10 years of training and however many years of experience on top of that, and to run into situations where you don't have all the answers. But it's kind of expected. I mean, everything is moving toward complexity. No one person could possibly know everything. That's just not practical. And even if you knew everything about, one subject, well, then you're kind of left out of a lot of other things, or you're left out of being able to integrate all the different connections between all these different things. So it's just a very complex and increasingly complex field. So it makes sense to use this integrative approach, or multidisciplinary approach.
Absolutely. And I mean, this is where wellness clinics are fantastic, because then you have a clinic with many different modalities in one. There's, that the more specialist side of even oncology for naturopathic doctors, which are known as FABNOs. And so they do a fellowship, and they are specifically just treating people and supporting people rather with cancer. And so, but from a very integrative approach, yes, you might be on chemotherapy, but then, you know, you're seeing a fabno and you're doing other things to support your body in the interns. So I don't see people with cancer. I will, you know, have a referral from a fabno, and then we'll do, you know, IV therapy, high dose vitamin C or whatnot. But you know, women's health, I'm letting go. To, you know,
Do you want to speak? Sorry, do you want to speak a little bit on that, because you did mention that you do like to work with pregnant mothers and to bring in your perspective and help them.
Right. So it's more of, I mean, and I don't say no to women that want to see me for women's health. Not at all. I think more around the bioidentical hormone therapy I don't do. So then I have a colleague in my office that I refer to do something specific like that. But when it comes to even menstrual irregularities, absolutely support. To pregnancy, preconception, absolutely. That piece I work on. You know, an optimal pregnancy, a healthy pregnancy, and I really work on labor support. This is an area that I feel as a mother that is an unknown, lacking area. It's more like, we worked hard to get pregnant. Now we're pregnant. I'm going to be birthing a child, but no one's really talking about what that experience will be. And then I have my baby afterwards. And that labor piece, because for me, it came when I found out I was with my son, I was incredibly scared to give birth. I did not want to have a C-section. I wanted to have a natural birth. I was frightened of the idea of actually birthing a child. I knew nothing. It's something you can't prepare for. You have no idea of you know, you're going to be birthing this 7, 8, 10-pound child. What does that mean? How do I prepare for something like that? So it's a real mind game in a way, where, you know, it's like, okay, well, I need to start reading positive stories. I need to be prepared for this. I need to understand more so of how the body works. And that's what I did. So I did hypnobirthing. I do labor induction with acupuncture in my office, and that has been incredibly successful. It doesn't bring labor on right away. It's more of working on bringing the baby down, helping with very slow cervical dilation. And so when the due date comes, rather than going over due date, be induced. And induction can largely leads to emergency C-sections because the woman has not fully dilated. So I have had some of my patients who were induced, but still gave birth naturally because the cervix did dilate. So that has been really a huge piece, a very important piece for me in my office, and speaking to women to empower them that you can do this if this is something you want to achieve, and know that we can do the acupuncture, we can do things after you've given birth. And so that has been really helpful. So I work with the doulas, and you know, they're a huge piece. They were a huge piece for me when I gave birth with my first son. Anyone that's first time mom, I highly recommend a doula. And then if you have a midwife or an OB, you have someone by your side all the time who is your doula. And when you get to the hospital, or if you have a home birth, you know, I had 2 home births, and I wanted, for me, more control. I wanted that experience, a quiet experience. I was fully prepared to go to the hospital if I needed to. I was right beside the hospital. And so I knew that was there if need. My first son, the obstetrician came to my house. I was in Singapore. And so I had great medical attention if we had to go there. And here in Canada, I had a midwife. And so, and both situations were fantastic and seamless. And of course there's risks, of course, with home birth. Understand your risks and you make that decision. But I see women who have been unfortunately traumatized in that labor experience. And as a result, that carries over, and now you're expected to take care of your child, and there's trauma there could be depression there. And hey, could that have been avoided? Yes, you could have had even a more laid out birth plan, so the people around you knew what you wanted. The father could have, stand in and say, no, we're not doing this or that. Same thing with the doula. And so there are options. I think women aren't aware of, because I don't want to see unhappy mothers with an infant. No one does. And so this piece is a really important piece that needs to be addressed. Just as mental health needs to be addressed, postpartum depression is a real thing. And you don't want to see women that are just, potentially this could have been avoided, maybe never been avoided. But at least, afterwards, like there's things that we can help you with. It could be thyroid problems, why she, postpartum depression. It could be low iron levels. I mean, her energy is incredibly low. So there's all these other things that can play into it. And so, even just this care, day and age where we're doing things on our own now. I mean, we used to have communities around us helping us, and it takes a village to raise a child. However, a lot of us do not have a village, and so expected to do it all on your own. Yeah, you're going to be tired and you might be miserable. And so know that there are people that obviously can help you, but at least having that conversation beforehand to be aware of, and at least, I've got moms that come in postpartum, and at least I'm there to check in. Other areas do we need to optimize? Okay, and I've given things for energy, and they're like, okay, I am back. Whatever you did, I'm back. I'm more energy, and now I know she's, obviously taking care of her child, but she's enjoying the experience even more so, because she might have a 2-year-old at home as well. She might also have a 5-year-old at home as well, and so that is just an intense part. Taking care of humans it takes a lot of effort and work. So, I mean, hats off to the mom that might be a stay-at-home mother, with 1, 2, 3 children or more, because I think the first time is a huge shock, just how everything is totally different. And then having the second child is even a huge shock, because now you have a little one and then, an infant. And so there's a lot of emotions and energy that goes in.
I'm not quite there yet, but I've heard plenty of stories. It is challenging. I mean, the information part is like, you want to be prepared for something that as big of a life event as that. You want to know everything you need to know, and ideally have a group of people to support you if things come up, because things always come up. There's no certainty in that kind of situation. So, but I'm surprised to hear that even with your training and your background, even like for yourself, you were still in a situation where you didn't have all the answers. You didn't know what was going to happen exactly. So, for somebody that doesn't have a medical background or isn't informed in how their bodies are changing and how that whole process is going to happen, and on top of that, it's their first child, that's a lot to process.
Totally. I mean, shall I say, we have obstetrical training as a naturopathic doctor, and you go through that and learn about certainly fetal development. And we were trained by a naturopathic doctor who was also a midwife. And because of her, I knew that I could do it. I felt because through her stories, I was empowered. I knew that I wanted a home birth. I knew there's interventions that I did not want to do. And because of her, I had a step up already. And I had a birth plan, that was kind of already there that she had shared. And so it was the unknown of the actual logistics of birthing a child, that no one can prepare you for. You have no idea. But I do want to, listeners, I think everyone should own and read if it's your first time giving birth. And it is a book called From Fear to Love, and it's by Red Miller, who is a midwife, Canadian midwife, who resides in Singapore. And I was so blessed when I moved from Dubai to Singapore to have met her. So things had fallen into place really nicely, and I had gotten a hold of the obstetrician. He was the only obstetrician of all of Singapore that would catch a child at home. And so he did take me on as a patient. So I was very blessed to have him. And I met her. She was very inspiring. And so it was, okay, all stars are aligned. And then, I had all of the friends that I would ask who had a child, all gave me great advice and mantras to say. And it was like, okay, I'm going to go into doing a marathon. That's what I'm going to be doing. Okay. that I'm going to be doing a marathon when I go into labor. So I knew that. So when you know something, you're more prepared for it rather than like, well, let's see how this goes. I don't really know what to
Definitely not
expect. I
something
kind
you
of
just
knew
want to
in
wing.
that way. Yes. No, it's not. Although some people I feel like are just wing it. Like, okay, well, as soon as contractions start, I guess I go to the hospital and then let's see what happens. I don't really know what to expect, how this is going to feel, what's going to happen. Even positions. I knew at least positions that I could put my body in for more optimal birthing, meaning being on my side, squatting are obviously using gravity. And if you're not laying on your back, you're actually allowing the pelvis, the sacrum, to move out even 2 centimeters more than had you been laying on it. So then that allows for that expansion even more simply by not lying on your back. A lot of obstetricians are not comfortable with catching a child in any other position. So the woman needs to be in that position. And that dates back to like Queen Elizabeth the First, her giving birth. And so on her back, and that's just, where it started. And so times are changing, information is flowing, and women are realizing that there are other options. Sure, you can go to a hospital, but know that you can squat, or you can be on your side when you give birth. And so just even the position in itself is helpful, giving birth, or being in a birthing pool, or just being, in the shower, can all help with pain management. So, Red talks about that kind of stuff in her book, and it's a really good resource just encompassing everything in terms of your options, because you're birthing a child, you're bringing a child in the world. You want that to be as positive as possible. For both you and your child. And, we're talking about our own human species, so let's take care of them, and the mother included. So yeah, it's a big part of what I do in practice.
I completely agree with you. We'll have to share a link of that book in one way or another, but yeah. So we'll make sure to do that. Thanks for sharing all that information, by the way. That was very informative. That was all new for me. I have not come across that before, but I appreciate it. Now I know, exactly. Now I'm prepared.
You're prepared. So when you have a partner that's pregnant, you're like, okay.
There we go.
Yeah.
Now I know.
And all this other stuff. Yeah. Excellent.
Thanks for that. I also wanted to ask you about the vaccine webinar series that you're working on or have built already. Can you tell me a little bit about that?
Yeah, so I built a 4-part vaccine optimization webinar, and they're about 2 hours each. I did that out of simply repeating myself a lot of information. So I can't ever talk 8 hours to one person in one day. So when you make webinars, so that's all in one place and many people can listen to it. So the first part, I talk about infant immunity. I just talk about a bit of history of vaccines, the development, where it came from, the idea. The second one talks about simply the infections. So statistics with the infections, what they are, what they look like, and people may not understand, well, what's Hep B? Isn't that Hep A? So understanding the difference between these infections and, what they represent, what they can do, the risks, what can happen if you do contract these infections. The third part is looking at some research. I think that's all that one is. There might be more in there. I think I talk about ingredients within vaccines. People have questions about that. And then the fourth one is solutions. And so I find the solutions is probably, I came from a country, Singapore, with mandated vaccines. And so in Canada, across the country, vaccines are by choice. They are not mandated. And there was, with that, people, in living in the 2 different countries and different ways of doing it, people wanted to know, well, okay, we're going to vaccinate. How do I optimize the situation? Either my child is getting sick all the time, really sick, so, we need to boost the immune system and get them healthy. How do I do that? So I built that, the solution aspect for people who are like, okay, well, we're going to vaccinate. How can we optimize this? people who have made the informed decision that they are not going to vaccinate. So what are we going to do with them? And if there's other things that we can do potentially because they have made that decision and they are not going to. So I respect every single decision that people make. Then I work with them. I'm one of very few, I don't even know, maybe one of maybe 3 NDs within British Columbia that actually administer vaccines. So I do give vaccines in my office. Currently, naturopathic doctors can only vaccinate for children ages 5 and above. So I legally cannot vaccinate children under that. So typically we're hitting kindergarten boosters, if adults want them, traveling. So those are the ones that I can offer. I have lots. I've had patients that them and their children have never been vaccinated. And then they come in, for example, they want tetanus. So we do a tetanus shot because none of them have had one before. So offering that, it's been a really, I really enjoy talking about vaccines when you have a subject such as vaccines that we are not to talk about it. It's very difficult to find someone to talk to you about it. Then that can really push a hesitancy movement. And the media has grabbed onto that naturopathic doctors somehow are the reason behind vaccine hesitancy. And shall I just put things straight right now? It is not naturopathic doctors at all that are at all part of vaccine hesitancy. We are not. That is no. If you look at books that have been written around vaccinations, there are a plethora of books, and none of them are going to be naturopathic doctors. I think I have one. But there are going to be written by medical doctors, pediatricians, PhD. They're not naturopathic doctors. Don't like bad press on naturopathic doctors. It's just outrageous and ridiculous. So I am here as a soundboard for people. I provide a safe place for people to talk because a lot of people really fear talking about vaccines with their medical doctor or even at public health. And no, they don't have enough time anyways. So the limit of time is always going to be the actual problem. And so vaccine consultations will be an hour. And I've had even, phone consults or, overseas Skype consults, just talking about, patients in Dubai, they've got mandated vaccines, Singapore mandated vaccines, Australia mandated vaccines. So there is no choice or change, shall we say, to the schedule. It's just like, okay, well, can you tell me more about the infection? Can you tell me more? I can optimize my children. Because I think there's more to this that we can offer as naturopathic doctors, a unique position at which we can offer, and being someone that can offer the vaccines if people want to do them, and I can do them. And so there's just, even if they choose, I only want to do X vaccine, I don't want to do the other 2. I will, to them they'll say, well, I will do them, but I don't want to do this one. Then that is their informed choice. They've consented to do that. And so I respect what they've consented to do. And so I am there to provide what they need without shaming them, without getting angry at them. Because as soon as you start shaming people and getting angry, guess what? They're not coming back to talk to you. No one likes to be treated like a child and yelled at. And so
definitely not. No, I can attest to that. But this whole topic of vaccinations is, especially when it comes to mandatory vaccinations, it's a touchy subject, very touchy subject, because of the history behind vaccinations. And I think one of the things that is salient on a lot of people's minds, especially in a country like Canada, it's full of people coming in from different countries, where in some cases mandatory, and in many other countries they don't even have access to vaccines, never mind the option of getting vaccinated for like our standard schedule that we have. So we can have an entire episode just on that, and that's such an interesting topic. So I'd love to get into that more. And we'll see what happens. Maybe we can follow up with that, because I'd love to talk to it.
Totally. I mean, you know, it's interesting. I mean, when we moved to Dubai, I had to do a tuberculosis test. I had to have an x-ray. I had to be checked for HIV to become a resident of Dubai. And I thought that was really interesting. I'm like, you could have someone that, okay, is moving to the country, and we could, and people say, well, that's really expensive. I'm like, well, if you want better surveillance of infection and knowing really where it's coming from, yes, we're a big country, but we could be doing more testing on people that are entering the country that are here to live. Because that was something, in order for me to stay and live in Dubai, they tested me for tuberculosis and HIV. And if I had either of those, I was not allowed in the country. So I thought that was really interesting.
Do you think maybe we're overly sensitive on some of these topics?
I don't know. I mean, I would hope to think that we're just not being passive, probably more from a financial perspective, organized perspective. I mean, Dubai was just organized. It just had their, checks and balances, and it's just like, well, you come in, you go to this place, you do that, see ya, goodbye. It was already implemented in place, and that's just how they did things. And so, organization factor, time factor. So it's like, well, I guess we just won't, or not. They don't know that they should do it. The idea is not there. I mean, you would think it would be, because, I mean, I know the fact that what it takes to live in Dubai. I mean, there must be other people that realize what other checks and balances other countries do in order to live in their country. So I just, and even, we had our dog, for example, in Dubai, who came from Canada, and then moving from Dubai to Singapore. Dubai was a red zone for rabies. So my dog had his rabies shot, but he hadn't had it in time. He just stayed in Singapore for a bit. But as soon as he came to Singapore, he was quarantined for an entire month to see if he developed rabies in that 1 month's time. So that implementation, where Canada, when I moved from Singapore to Canada, I mean, they didn't, it was fine. They didn't do anything. And I'm not suggesting that we need to put dogs in quarantine, because that's rough, but it's just like interesting. Other countries do different things in order to perhaps ensure the spread of certain infections don't happen. So they have those checks and balances in place. And as soon as you get the program going, it's like, okay, we've got it going. It's smooth. It's just how we do things now. So I just thought that was really, really interesting. So yeah, the mandatory piece, I can't say I agree with mandates, because when you start mandating, and even for children, you're going to be mandating for adults. And I don't like the idea that I can't have a choice of what I want to do with my body, because you start mandating, I mean, it just keeps going. And so there is checks and balances, again, with vaccines. That choice is there, that informed decision is made. And so, public health is doing their job. I'm doing my job. So we're, and do best should for children and adults. And even the point that I've been doing even more in my office lately is checking community immunity. And by that, I mean doing titers. So there are some docs that feel that titers they're maybe useless, flawed, something that they, isn't important. But we do titers in pregnant women for rubella and hepatitis B. And if they are reactive, meaning they have had exposure either naturally through a vaccine, then we say they have immunity to those things. And I think that same sort of checks and balances for a community could still be there as well. A blood draw is easy. It takes a minute. And I send that off and I get my answer. And then we have a more informed decision of what needs to happen, because even with vaccines, they can wane. They may not last forever. Right. So you do boosters, or you're not seroconverting very well. Your immune system isn't taking that antigen and making an antibody, perhaps. The idea of our community's immunity, then we have an idea of herd immunity within our community, rather than thinking, well, the vaccine should be 95% effective, but I like to actually know if it 100% is within the community. And so this is where I will do titers to check. And so you could do typically for viral ones, so hepatitis B, measles, mumps, rubella, chickenpox, and see like, okay, there is immunity to these things. Great. We know that now. So that's good information, I think, to have and to know, because it's effective and useful in pregnancy. It should be effective and useful in children and adults. You don't need to be pregnant to know if you have rubella or Hep B immunity. Right.
I think we can definitely come back to this whole topic on another episode. I'd love to get into this in more depth for sure. So I mentioned that we will get back to the topic of technology. And I wanted to take this opportunity to get back into it. So you mentioned a couple of interesting things, I think, today so far. So you mentioned that the webinars that you've built, those are obviously shareable by way of, as simple as links. You can upload them nowadays to about 1 million different platforms to share with, 1 million different people. We talked about Facebook groups and how that is a place where people can gather and learn a lot from other people who've been through very similar experiences and share information and get advice and just be part of a community of people that have been through a very similar experience. So there's a lot of technology and a lot of different ways that people can leverage it to heal, to self-heal in many cases. I wonder, in the space of naturopathic medicine, what do you see as the role? I'll just start off with like a really broad question, but what do you see the role of technology? Because there's so many different ways in which it can be used, but it's certainly not optimized yet.
Right. A great resource. It's a great resource, certainly in terms of technology, being able to synthesize and even helpful in terms of someone being like, I go through the signs and symptoms, they're wading through what potentially is the cause. And then that's helpful, for myself and even perhaps a medical doctor to help you hone in and narrow in, maybe this is what the problem is. Of course, then, as any practitioner, we don't want to have those blinders on and be like, okay, this is what you have. But that's where the art and the uniqueness of obviously talking to a person, because I've seen so many different things and I can bring all of that in and be like, well, this might be what's going on. But then I have to take a step back. It may be that, but we can't not dismiss X, Y, and Z either. People to textbook. Someone walks in, I can't flip and then say, well, go to page 350 because that's me. And then I can say, oh yeah, this is how we're going to treat it because this is you. No one is a walking textbook. And a lot of things look like something else. I've had 3 patients that I've had misdiagnosed with mumps, for example. Either the GP assumed it wasn't mumps because they were vaccinated or thought maybe they were vaccinated and therefore they couldn't possibly be mumps. But this, huge enlarged parotid gland on the side of their, is obviously clearly, well, that looks like mumps. You weren't tested for it to see if you had an active infection. So going online, going on these platforms can be helpful, but always keeping in mind to be careful with that, because if you start to self-treat, there are moments when I have heard people that come to me and feel awful. I'm like, well, this is why. And they're like, I didn't even know about that, or I didn't even know that I didn't understand that biochemistry piece. I have a huge poster on my wall, but looking at genetic SNPs, when we dive into MTHFR and what is CBS and what is PON1 and what is all of these and how does this play a role within my health overall as well. So then you get into the genetic side and then epigenetic side. And so you're like, oh, I didn't realize that if I had MTHFR, so I just started taking 5 milligrams of methylfolate and now I feel awful. I'm like, okay, well, because that methylfolate had to go somewhere, because the next enzyme couldn't handle it. So you had a huge overflow, and you didn't know that methylfolate can convert to glutamate, and you didn't know glutamate can spike histamine. And so now we're dealing with a high histamine problem and all the symptoms that come with, histamine overload. And so this is where someone gets diagnosed, and that's a problem with now mast cells and histamine. That's a big problem. Mood, skin, digestive problems. We might think it's Lyme, but it's not. It could be this instead. However, something's activating those mast cells to be out of control. What is that? What is doing that? So it is a sea ebb and flow of information that sometimes it is really overwhelming. And there are moments where it's incredibly helpful because it has helped synthesize of what actually is going on, what we need to focus on. And at least you're coming to the table of, okay, and I have a lot of patients who are like, okay, what about this? What about this? What about this? And that saves a lot of time. It does, because then I can put my clinical experience, things that I've learned, and then be like, I don't actually know. I need to look into this as well for you. Or we need to do this testing that will help clarify if maybe this is the problem. So you have to be an advocate of your own health today, 2019. Have to figure what's going on with you, because there is limited time, limited experience. To be a well-informed naturopathic doctor, it takes a lot of work. I mean, I am going to conferences 2 times a month, it seems. My husband drives him crazy, the amount of conferences I go to.
There are a lot of conferences.
There are a lot of conferences. There's so many more coming out, and they're so good, and all these speakers, and they bring their clinical experience and evidence, and it's just, but you got to be hungry, to want to do these things, because you're just like, man, I don't know the answer to that. I don't know why this patient feels this way. Please tell me why. And then, you go through it with someone that's, been doing it for so much longer. That's all they, and then you go to the next speaker and you dive into them. And then so you take all of these clinical pearls back. You're like, okay, I have a new treatment plan, I have new ideas now. Now we can start doing these things to figure that out. And 20 years to figure that out. And then I just learned it all in 10 minutes. So, and I'm, by speaking to them, and I'm going to use that and apply that. So, because ailments and conditions are more complicated today. They are. And because there's more things at play. We are a sicker bunch, and there's a lot of things that play into that. Of course, there's more understanding as to why, but there are things that we cannot get away from in our environment that are playing into why the way we feel. And so we have to navigate and deal with that in some way. And some people, it bothers them more than others, like mold. Some people are not going to be affected by mold, and there's mold illness is a real thing. And so dealing with mold is a real problem. So heavy metals will affect some people over other people. Ability to detox is going to affect some people over other people. And it can be what piece to do first and what piece to do last. And this is why seeing someone that has tried to understand what to do can be very helpful, at least. And I have patients that are like, look, I've been treating myself for a year, I'm getting better, but I just need you to tweak this, or your thoughts on this, or what have you heard about this? Because it can take you months to navigate. I mean, if someone with severe brain fog and concentration problems does not want to sit on a computer all day long trying to figure out what's wrong with them, because that might really hurt their eyes, or just like, I can't focus, I've got major brain fog. So we got to lift that fog, and so they can think again. And no blood work is going to tell you that you have brain fog. It's just is. So I don't know if that answers your question.
Absolutely it does. No, it absolutely does, because it sounds like in this age when we have so much information, there's an even greater need for someone to really boil that down, put it into perspective, and give you an objective sort of interpretation of how what all of that information means for you as an individual patient. So in fact, it's not that we don't need experts who've trained in this anymore. In fact, we need them even more, because there's too much information.
Yeah.
I want to ask you about 3 specific technologies just quickly, and see if you use these in your practice, or maybe anticipate using them. There are a couple of healthcare systems, I think, around the world that are getting into this area of, prescribing mobile apps. It's kind of a strange topic, but for example, I think in the UK they have a policy on this, and some of these actually might even be reimbursed. But as a physician, you might even prescribe a app that helps a patient deal with their weight. So they'll put them on a schedule, let's say, or put them on a dietary plan, or a combination of the two, incorporating physical activity elements. But these are literally prescriptions that a physician would write for a government approved mobile app that a patient could then use. Do you see yourself getting into that? There are plenty of applications for I guess, in the realm of naturopathic medicine. But do you see yourself using those?
Yeah, totally. I mean, other apps, just tracking ovulation, tracking when a woman had their period, yeah, is incredibly helpful. So I've already using some apps, and some apps, I just don't even know that they're there to use. So, this is obviously where a conference comes in, and you learn all this new fun stuff that you can use, because we are a technology world, absolutely on our phones all the time. And if I can plug in, I mean, I do know have patients with weight loss have used apps plugging in, their calories, what they've eaten, and then at the end of the day shows that, and it tracks that way. Totally helpful. I mean, I could see even progression with children in terms of behavior. We implemented a certain supplement, writing down, keeping a journal, but I mean, an app of something of following, because they're like, okay, it was the GABA that did it, or no, it was the L-theanine that did it, or no, it was, whatever, product that it was, like, ding, that's what that did it. And that, I try to have people to write it down, write down on your treatment plan where you felt the difference and what's working, what is working for you, please tell me. And so an app would be really good to plug in those kind of things. But yes, apps, absolutely. Yeah.
Okay, telehealth. So much in the same way as we're communicating here, there are tons of applications and technologies where you can interact with physicians, and there are even companies coming out with systems where you can sort of plan some of these things ahead of time. So you'll know what type of meeting you want to have with the patient based on factors that you would have learned about the patient ahead of time. And so you can decide, do I need to meet this patient for this particular reason in person, or can I just meet them via like a Skype type of application? Is that something that you see yourself using, like rather than just face-to-face digital?
Probably not. And I'll tell you why. Because sometimes you do need to do a physical exam. A lot of times you do. And I can't do that via Skype. There is a huge component to healing when you can actually face-to-face trust value when you're in the room with someone, and versus having a screen in front of you. However, I do Skype consults as well with new people, more from a questions based, not necessarily treatment based, more of a questions based consults. But there's a real value with, seeing someone and not losing that touch. And even if you do need to touch abdominal pain, let's see, let me look at your skin. Let me see, oh, I see it's raised. It's not flat. Let me check, let me look at the color of your eye. And so I do find that there's a strong connection and trust value by being in the room with someone. But there are other applications in terms of, I wouldn't really need to see you in office for this. If it's just a questions, yes or no, I'm curious to understand this better, then those kind of consultations are totally worthwhile. Yep.
Mm-hmm. Okay. And the last one I wanted to ask you about, since you also mentioned this before, genetic testing and how that contributes to personalizing treatment for individual patients, and actually going beyond just genetic testing, but genomic testing, whole genome sequencing, all the way up to proteomics and so on and so forth.
Yeah. I mean, whole genome sequencing, I usually have children on the spectrum do that. It sort of tells us how far we could ever go with treatment. Even if it was a gene from the parents, or if it was de novo, then, you're talking about if you do stem cells or not. So then you would know if you could do that or not. But then, looking at genetic SNPs, it's a big area, absolutely. And has helped tweak my treatment plans. It's not my be all end all. It shouldn't ever be for anyone. You cannot look at a genetic variant and say, I know how to treat you. No, it's a color on a paper. You're either wild, hetero, or homozygous within, let's say, MTHFR or CBS, but that doesn't tell you the function, though. And there's more sophisticated tests you can do to tell you, well, the function. What's my homocysteine levels? What is my glutathione levels? What is my folate levels? So, because even though you have the variant, doesn't mean it 100% doesn't work anymore. MTHFR, combo hetero, I cannot make folate, methylfolate. No, that's actually not true. You can make methylfolate. You want to make sure you don't take folic acid though anymore at all. And for you might have to be on a paleo diet because grains have folic acid in it. So that might, change a bit of understanding that way. And it is very useful. Done a lot of, people do 23andMe, doing a lot of just going through their genetics in an hour, just understanding what they represent, what they do, what the function of them, and how that might be affecting their overall wellness. So yes, yeah, it's definitely a slice absolutely to the whole pie of understanding someone's, ailments.
I like the way you put that. It's just one slice.
We have many slices, and we gotta get to all the slices, and then we got there.
The further down you go in these genetic and any kind of molecular genetic testing, the more you open up sort of a can of worms, because the irony in these testings is that we don't have all the answers. We don't know what all the interactions are, and so you can layer on all sorts of complexities like, gene-gene interactions, gene-drug interactions, drug-drug interactions, and then environmental interactions. And you're like, you can't, there's no way to predict what the outcome is or what the exact cause is. There are too many things.
Too many variables. I mean, that's why we have to treat every individual as an individual. We can't treat them as a piece of paper. It says on the piece of paper, it's like, no, I'm going to sit here and listen to you. I'm hearing this and this. Okay, so these are the things that I think that we should be doing with you, regardless actually what your SNPs say. Let's see what this does instead. They're going to help me maybe navigate, but yeah, I'm sure there's algorithms. I'm sure it's going to come. People are trying. There's different companies that are trying. 23andMe, yes, it gives you your raw data, our support, which doesn't tell you anything about it. It just tells you the SNPs you have. Pure Genomics has one. Of course, the free ones, Live Wello and Genetic Genie, which I don't use those ones. Strategyne's another good one. But there's all these ones that, a lot of the SNPs don't have really any evidence around. They're there, but we don't really know what they do yet, because it takes years to understand. So I just try to learn from the people that are doing the research. Yeah.
And there certainly is a ton of research happening, and the computational approaches are getting more and more sophisticated. So there are some people that think that it's just a matter of time before we know the answers. And even on that topic, and that's a whole other episode in and of itself, because there are multiple camps in terms of the approach, right? There are some people that say the more of these interactions that the more you can piece them together, that should give you a better prediction. Turns out that doesn't always happen, and so you get other people that are into a totally different set of approaches that say we can come up with these algorithms that you just like these machine learning algorithms that will figure out a way to arrive at an answer that you'd expect or that you consider to be accurate, but we then can't work backward to understand how in the world it is that they came up with that answer to begin with. So it's almost like a black box. Anyway, so that's a whole topic in and of itself. Very fascinating stuff.
Yeah. Awesome.
Dr. Taylor Bean, it's been an absolute pleasure speaking with you today.
This has been great. This is fun, talking about this stuff. We can talk about this stuff all day long.
I'm glad. So I wish you ongoing success in your mission to help mothers achieve healthy pregnancies and to raise thriving and happy children.
Thank you. Thank you so much. Thanks for having me. This is great.
Absolutely. And maybe we can have you come back again for another episode.
Totally.
Awesome. Okay, to our viewers, we'll see you next time.